Hello, good afternoon, everyone. First of all, let me introduce myself. My name is Sammy Lazuardi Ginanjar, but you can call me Sammy. Today, I am going to talk about how to give medicine to your child. Firstly, I will talk about the introduction, then about 5 rules of giving medication, and finally, the conclusion. So here, the introduction. For many parents, keeping track of their children's homework and extracurricular activities can be a daunting task. Adding the need to administer a medication, which needs to be given on time, at the right dose, to the right person, can create a whole host of challenges. Unfortunately, improper use of medication can lead to potentially harmful medication errors and potentially lessen the effectiveness of the therapy. To help reduce the risk of medication errors, nurses are taught the 5 rights of medication administration, also known as the 5 Rs. These principles help to ensure the right drug, right dose, right route, and right patient at the right time. At home, parents and caregivers often assume the role of nurse in caring for children and the loved ones and should be encouraged to follow the same 5 Rs of medication safety. Here is what they need to know. First one, right drug. Double check the label and the bottle. It can be easy to accidentally give the wrong child the wrong medication. So it is important to parents to ensure to double check the label and the bottle action. Second, right dose. Most of the time, this can be achieved just by double checking the label to see what dose needs to be given. Third, right route. For example, ear drops administered as eye drops or swallowing medication intended to be used with an inhaler. Be sure to double check the label to ensure that the right medication is being administered via the right route. Right time. Be aware of dosing frequency. Although most medications are taken once a day, some are prescribed to be taken 2 or even 3 to 4 times a day. Use a schedule or medication log. The more doses a drug requires throughout the day, the more likely parents may forget to administer a dose. To avoid this from happening, create a schedule or use an online medication log as a visual or electronic reminder to administer the next dose. Set an alarm. Set a cell phone alarm or other reminder to help remember when doses are due. Doses are due. Lastly, communicate clearly. Many dosing mistakes, especially double dosing, happens from a communication mishaps. Keeping a physical schedule handy that both parents and other caregivers can access and be sure to check off when a medication was administered. Lastly, right person. Take a careful second look to ensure that the name on the bottle matches with the child. This is especially important in households with multiple people on different medication. To sum up, following the 5 rights of medication administration helps to ensure the right drug, right dose, right route, and the right patient at the right time. Well, that's all about my explanation. Thank you very much and goodbye.